Health officials at the Centers for Disease Control and Prevention now recommending fewer vaccines for children, changing the U.S. childhood immunization schedule. Health Secretary Robert F. Kennedy Jr. saying in a statement, scaling back vaccinations aligns the U.S. childhood vaccine schedule with international consensus. But this move by the Trump administration is drawing criticism from some pediatricians. Derek Lytle spoke with the chair of the Committee on Infectious Diseases for the American Academy of Pediatrics. Derek, what does he say about this?
Yeah, Dana, that doctor, AAP's Dr. Sean O'Leary, tells me that moves like this one should be done carefully with decades of science-backed research. Now, he questions the move and says it leaves an aftertaste of distrust moving forward. The CDC recommendation revised, now no longer recommending children receive influenza, COVID, or rotavirus.
Tragically, our federal government can no longer be trusted in this role. What is going on now is completely unacceptable.
O'Leary believes there are mixed messages being spread, and it's creating confusion for parents.
Parents deserve clear, consistent, evidence-based guidance they can trust.
The plan announced today by the Department of Health and Human Services Secretary Robert F. Kennedy also suggests only high-risk groups should now receive vaccines for RSV, Hepatitis A, Hepatitis B, and Meningococcal ACWY. According to the CDC, the new guidance comes after a scientific review of the underlying science and comparison with immunization schedules of peer-developed nations.
Let me be clear, what was announced today is part of a decades-long effort on the part of the health secretary to spread fear and falsehoods about vaccines, and this is another step in the secretary's effort to dismantle the U.S. vaccination system.
Dr. O'Leary says more children could be diagnosed with preventable illnesses, putting children across the country in unnecessary danger.
These decisions matter. Children's health and children's lives are at stake. There's no evidence that skipping or delaying certain vaccines is beneficial for U.S. children.
Dr. O'Leary is worried these changes to the childhood vaccination schedule could have lasting negative impacts.
They're at risk for these diseases that we can prevent with a very simple, safe, effective intervention. And some of these diseases are severe.
Now, Dr. O'Leary says regardless of these new recommendations, people should be consulting with their family doctor before making any decisions on what vaccines to give and not give your child. Derek Lytle, 13 News Now.
All right, thanks so much, Derek.